Hello everyone, this is Group 5 and today we're going to talk about bloodborne pathogens. And our objectives for this video is to know what is bloodborne pathogens and to learn the common oral and respiratory diseases that may be exposed in a dental clinic. So what is bloodborne pathogens?
Bloodborne pathogens are microorganisms present in blood and can cause life-threatening diseases in humans. These pathogens are transmitted through human blood and other fluids that may contain blood, including semen, vaginal secretion, intestinal secretion, synovial fluid, mother's milk, tears, pericardial fluid, amniotic fluid, and saliva. These bodily fluids must be considered as potential infectious materials, which should be treated the same way as blood. Bloodborne pathogens are spread when blood or other potentially infectious materials contacts a person's mouth, nose, eyes, or broken skin. Needle sticks are the most common source of infection, and cuts from contaminated sharps such as broken glass are another frequent source of infection.
The most common diseases that are caused by bloodborne pathogens are viral hepatitis, acute retroviral syndrome, and acquired immunodeficiency syndrome or AIDS. Viral hepatitis causes inflammation of the liver. It can cause cirrhosis and liver cancer. Symptoms include fatigue, abdominal pain, loss of appetite, yellow skin or eyes, also known as jaundice, and vomiting.
There are 5 common types of viral hepatitis. We have hepatitis A, B, C, D, and E. Hepatitis A virus or HAV and hepatitis E virus or HEV are not bloodborne pathogens. These diseases are transmitted mainly through contaminated food and waste or fecal-oral route of spread, and do not pose a particular occupational risk to health workers or patients. Hepatitis B virus or HBV is a bloodborne disease and prime health problem in many parts of the world. In terms of transmission, HBV can spread through direct or indirect contact with infected body fluids, or from infected mother to child, through sexual transmission, or from contaminated needles. It remains contagious at room temperature for at least 1 month. When outside the human body, HBV are easily killed or inactivated by simple methods of sterilization and disinfection, including 10-minute exposure to 1:100 diluted bleach, 1:16 diluted phenolic glyceraldehyde, 75 ppm or parts per million iodophor, or 70% isopropyl alcohol, and steam autoclave.
Hepatitis C virus HCV is also a bloodborne disease and also transmitted the same way as hepatitis B virus HBV. This disease is formally known as parenterally transmitted non-A, non-B hepatitis. Another bloodborne hepatitis virus is hepatitis D virus HDV, formerly known as the Delta agent. This pathogen may only cause infection in the presence of active HBV infection. HDV infection can happen concurrently with HBV infection, a co-infection, or a superinfection of HDV in an HBV carrier.
HIV are viruses that cause acute retroviral syndrome. This disease signifies the acute infection of HIV. 4 weeks after their initial HIV infection, many people experience symptoms such as sore throat, fever, swollen glands, diarrhea, joint pain, and fatigue. HIV also causes acquired immunodeficiency syndrome or AIDS. These conditions weaken the immune system, which makes the person highly susceptible to virus illnesses and has no cure. Early AIDS symptoms frequently present as oral lesion. Oral symptoms include fungal infection, such as oral thrush or candidiasis, histoplasmosis, geotrichosis, or cryptococcosis. Viral disease such as warts, hiruleucoplakia, or human herpes virus type 1, or herpes simplex infection, bacterial diseases such as rapidly progressing periodontitis, or gingivitis, and cancerous diseases such as Kaposi sarcoma and non-Hodgkin lymphoma. Now let's proceed to the common oral and respiratory diseases that may be exposed in the dental clinic.
The dentist and the dental team, as well as the patients, are all extremely vulnerable to many infectious disease. Identifying and understanding the common oral and respiratory disease in dental clinic will help us avoid contracting these illnesses and transmitting them to others. Human herpes virus type 1, also known as herpetic simplex virus 1, causes primary herpetic gingival stomatitis. It is primarily seen in children younger than 5 years old and those people who are immunocompromised. It infects the mouth, skin, and genitals. The primary lesions are accompanied by fever, arthralgia, malaise, anorexia, headache, and cervical lymphadenopathy. Recurrence of these diseases is called secondary herpetic simplex infection. HBV type 1 and genital herpes can also cause herpetic whitlow. Before the advent of universal precautions and the consistent use of gloves during the oral examination or treatment, this type of infections typically infect the fingers of a dental practitioner, also called wet finger dentist.
Oral candidiasis or oral thrush is caused by a fungus called Candida albicans. These are opportunistic organisms that transmitted via direct contact. People with suppressed immune system, dysfunctional immune system, extreme age, example is very young and very old, ill-fitting dentures, and people who are taking long broad-spectrum antibiotics are susceptible to this infection.
Syphilis is caused by a spirochete bacterium called Treponema pallidum. It initially occurs on the lips or tongue as a painless indurated ulcer called primary chancre. Untreated syphilis will further progress to secondary syphilis and begin about 2 to 10 weeks after the initial symptoms appear. Secondary syphilis causes elevated broad-based verrucal plaques called condyloma lata that may appear on the skin and mucosal surface. 30% of untreated syphilis will progress to tertiary syphilis, which may affect the cardiovascular system and the CNS. All stages of syphilis are contagious through sexual contact and direct contact of lesions. Syphilis can also be transmitted from an infected mother to child called the congenital syphilis.
Gonorrhea is caused by another sexually transmitted disease called Neisseria gonorrhoeae. This disease infects the mucous membrane of the penis or vagina and may be spread through the mouth during a certain sex practice. The most common chief complaint of this disease is sore throat.
Herpagena are usually endemic, with outbreaks occurring in the summer. This disease is caused by Coxsackie virus type A1, 6, 8, 10, 22. Herpagena is not usually treated because it is self-limited and lasts less than a week.
Hand, foot, and mouth disease. This is a vesicular type of disease that affects children younger than 5 years of age. Signs and symptoms are usually mild to moderate in intensity and include low-grade fever, malaise, lymphadenopathy, and sore mouth. Pain from oral lesions is often the chief complaint. This disease is caused by a virus called Coxsackie virus A16.
Varicella or chickenpox is a common respiratory disease in children caused by human herpes type 3 or varicella zoster virus. In adults, reactivation or secondary disease of varicella zoster virus is called shingles. Shingles are occasionally accompanied by systemic symptoms including post-herpetic neuralgia, motor major reduction, and burden of disease.
Streptococcus pyogenes are bacterium that are spread through droplets and can cause streptococcal pharyngitis and scarlet fever. Patients infected with streptococcal pyogenes experience post-streptococcal complications involving the heart and kidneys. These patients are protected from potential reinfection by receiving antibiotics prior to obtaining dental or medical care.
Tuberculosis is caused by Mycobacterium tuberculosis and spreads through close contact and long exposure to infectious droplets. Tuberculosis may appear on any mucosal surface. The tongue and the palate are favored locations. The typical lesion is an indurated chronic non-healing ulcer that is usually painful. Pharyngeal involvement results in painful ulcers which may cause dysphagia, odynophagia, and voice changes. Other pathogens that affect the respiratory system include the Streptococcus pneumoniae and influenza viruses type A and type B.
I hope you guys learned something today. Thank you for watching.